Hello and welcome to another episode of The Nation. I'm Gerard Ratnam. Eczema is a chronic skin condition that causes dry, itchy, inflamed and irritated skin. There are different types and it apparently can vary in severity. Some say it's almost impossible to find a cure for eczema. To answer all questions on eczema or the eczema dilemma, I'm joined by DATO Dr. NOOR ZALMY AZIZAN, consultant dermatologist at Hospital Kuala Lumpur. She's also the immediate past president of the Dermatological Society of Malaysia. Doctor, thank you very much for taking time off to be with us today. It's good to have you here in the studio. Just so much to unpack with regards to eczema and what this skin problem is. Now, I'd like to begin with this. What is the underlying mechanism that causes eczema and how does it differ from other skin conditions?
Okay, thank you, Gerard. Thank you for having me here. First of all, people need to understand that the pathophysiology, that means the mechanism why you get eczema, is actually multifactorial. It's not just one due to one cause. So what I mean by multifactorial, obviously there could be a genetic component and there's also environmental trigger.
Okay.
So the genetic component is where your barrier function is impaired, and then you have this immune dysregulation and environmental trigger that makes people's skin more inflamed, and plus there's also this thing called the skin microbiome is actually disrupted as well. So there's at least 4 main pathophysiology why you would get eczema.
Right.
So why is it differ from other skin diseases? First of all, it's one of the most itchiest conditions. So if it does not itch, we always say it's not eczema.
Right.
So that's why, I mean, like sometimes when you have psoriasis, it may not be so itchy, but a person who suffers from eczema is really itchy. And some of them, would not be able to sleep at night.
So help me understand this. So what you're saying is chronic dry skin can also make its way to becoming eczema if it becomes itchy.
Yeah, first of all, when you talk about eczema, it's inflammation of the skin.
Right.
It's also synonymous to dermatitis. So eczema is a broad spectrum for anything that's red and scaly, basically, and itch.
And okay, so what is dermatitis then?
So it's the same.
Yep.
Is that the Americans like to use dermatitis and our British counterparts likes to use eczema.
Right.
So we kind of like adopt it from the British, we would call
and
eczema.
We here in Asia always Forrest Gump from one to the other without knowing.
Yeah.
So dermatitis and eczema is one and the same.
Yes,
it's just
they are the same.
British or American. Right.
Yeah.
Now, they say eczema is a collective term for several skin conditions that cause red, itchy and inflamed skin. You just mentioned that.
Yeah.
It is not contagious, and it can be triggered by a variety of factors, including genetics, environmental factors, and immune system dysfunction. This is all you've told us. Now, with all this, armed with all this knowledge about eczema, what more have we learnt about it? Now, a lot of studies have been done in the past 10 years, 20 years, and I'm sure from the time you started dermatology up until now, we've
found a lot of discoveries, because when I started dermatology, there was nobody actually mentioned about filaggrin mutation. So now they've discovered that people with eczema, when I talk about the genetic component, they do have this thing what we call filaggrin mutation.
How do you spell that?
Filaggrin, filaggrin. So this is just a type of protein in the skin where people with eczema has a gene mutation in this protein, and it makes them less filaggrin. So because of less filaggrin, therefore their barrier function is impaired. And you won't, basically people would, like, if you have a normal skin, you would get this nice brick and mortar. If you look at your skin, as the brick is the keratinocytes with the skin cells, and the mortar is in between the cells that holds the cement together, holds the brick together. So in terms of filaggrin as well, you kind of, it'll be lack of the protein, and it makes the skin more leaky, so you get more water loss. So that's what people have discovered about the filaggrin gene mutation, and that is due to the barrier function that is discovered. But there's also discovered about the immune dysregulation. And with that, when they discovered that, they found the pathway that actually sets off all this immune reaction. And recent studies have shown if you cut off that pathway, you don't really have to give a blanket or a bullet immunosuppressant. You just target that pathway, and hopefully you won't get more other side effects from having
what can be done to target this certain pathway they're talking about?
Yes, yeah.
What kind of interventions do we have now?
Well, we're talking about, okay, we're going straight jump into interventions because that's very expensive drugs you're talking about, you know. So you do have the biologic treatment, and that biologic treatment is where it targets the interleukin-4 receptor, and that breaks down, reduce or inhibit your interleukin 13 and 4, where it makes the eczema very red and inflamed skin. Okay, so we have biologic treatment, or what we call dupilumab. The trade name for that is Dupixent. So that's the only biologic in the market for eczema. And now you're also looking at JAK inhibitors. These are new small molecules that actually also inhibits the inflammatory pathway in atopic eczema. This is if you're talking about atopic eczema. It doesn't really work for the other eczema so much because eczema, as I say, is a blanket term for all skin that's itchy, red and scaly. But you do have eczema due to other condition, like what contact dermatitis is also an eczema, but that is due to you putting products that doesn't agree with you. So that
so contact dermatitis simply means that if you're using products that don't agree with you, you get an inflamed skin. So that's known as contact dermatitis. So today we know. Now, they say that there are different types of eczema. Which one's the worst?
I would say anything could be worse. So it's, I mean, your atopic eczema could be worse as well. And the thing about atopic eczema, there's a lot of studies in atopic eczema, and that is an endogenous eczema. It means the eczema is coming within you, because we're talking about the barrier function defect, the immune dysregulation. But that's this thing, exogenous, and exogenous is the eczema, you get eczema because of outside interference, and one of it is contact dermatitis. You also get an eczema because of you're allergic to a drug. And so that could be an eczema triggered by allergic reaction to a drug. So it's kind of like, if it's, you know, the cause for exogenous eczema, if you kind of eliminate the cause, you actually get cured in a way, but not for atopic eczema because it's coming within you. So in terms of worse severity, everything, both endogenous and exogenous eczema can be worse if you do not manage it properly. Because once you have any breaks in your skin, you're looking at septicemia, you're looking at a lot of, it's bad news all the way. And you would get what we call skin failure. I mean, you heard of heart failure, I'm sure, but nobody heard of skin failure. So we do have people coming to our ward because of skin failure.
Well, when you talk about that, when you talk about eczema, which when it's exacerbated, it can even go up to skin failure. But let's go back a little bit and talk about eczema and allergies. A lot of ENTs talk about eczema and allergies. They look at your face and they say, you seem to have, and I have this problem, you seem to have a really dry skin around your eyes. You might be having eczema. I don't know what they mean by that. But then they also say, it's because of your allergies. It's probably because of your allergies. Your rhinitis brings about skin conditions. Is that true?
Well, in terms of allergies, because you want to know what do you mean by allergy. Normally I ask when people say I'm allergic to something, I say, what do you mean by allergy? In a way, what you mean by allergic rhinitis, it could be because eczema is, like I always say, a condition where it's an atopic condition, atopic eczema. So you are a atopic person. That means you're prone to get atopic eczema. You're prone to get asthma. You're prone to get allergic conjunctivitis and also allergic rhinitis. So these are, that means your kind of skin is hypersensitive in some ways and you get all these conditions. So you are an atopic person. So that does not mean you're allergic to certain things, So when you talk about food allergy, which is a bit different, so a person who's an atopic person, they may get all three conditions. So I always say eczema is a brother or a sibling of asthma, allergic rhinitis, and also allergic conjunctivitis.
I like the way you put that. Asthma is a brother of? Eczema is a brother of asthma.
So it's a whole family. So some people, so every time when I get a history of a person who's having rash, I always ask for a family history.
Right.
And most of the time I would ask whether there's any of the first degree relative suffers from asthma, allergic rhinitis, or allergic conjunctivitis, or so forth.
Right. So basically, with asthma now, the way we treat it is the use of steroid creams, hydrocortisone, so on, so on, so forth. And there are also other conventional treatments. But they say with these treatments, the problem is it provides temporary relief.
Yeah.
So,
well, in a way, as I say, it's multifactorial.
Yeah, it's multifactorial. Yeah.
So first and foremost, you need to know about your triggers. You know, so most of the time, people with atopic eczema, they get eczema gets worse in a very dusty condition, because that means a lot of the times they're allergic to house dust mites. So you need to find your environmental triggers, and then you need to improve your barrier function. Remember, we were talking about that filaggrin mutation, and then you get this leaky skin, which makes you very dry. That means increased transepidermal water loss. So you need to also combat that. So in any stages of eczema is always moisturizer.
Yeah, but the problem with Malaysia also is because of the humidity in the country, and now they say when your humidity levels within the home is more than 60% or moving into the 70s, you tend to get allergies in your house, and that might exacerbate whatever skin problems you have. So saying, like you said, asthma is a cousin of eczema. Once your asthma start acting up, you start breaking into skin problems too. So what do you tell your patients or people you see with regards to this? How do you control humidity level? Because people are saying, just working around eczema, people are selling air purifiers, they are selling probiotics, $1 billion marketing business and a marketing scheme. Well, what do you have to say about stuff like this?
I mean, obviously humidity is very high in Malaysia, but the trouble is it's high, but people, if you go to a building like this building, it's very cold, and you're going to like almost probably Antarctic temperature.
So saying this is warrant for me to buy a 2,000 ringgit dehumidifier to bring down the humidity in my house if I have these problems?
Well, not really, because a lot of the times people in humid country, actually your eczema is a bit better than cold, because in cold country you actually gets more dry. So a lot of the times I have my patients, when they come to Malaysia, their eczema is better, but when they go over and goes back to study in United Kingdom or something like that, their eczema gets a flare. So it's actually not so much as controlling the humidity, because humidity is actually in a way good for the skin. It's how you want to manage it. Is you still need to apply your moisturizer, and there's a lot of moisturizer, the types of moisturizer from lotion to emollient to ointment. So it depends, and I normally have to teach them how to use their moisturizer, because as I say, first of all, control your barrier function, and then you look into expensive drugs, because if the basic care is not there, there's no point going into all the expensive drugs.
So when you say barrier function, means if you have to moisturize every day, you need to moisturize on time, make sure it's twice, 3 times a day.
3 times a day at
so
least.
That's called taking care of your barrier function.
Yes.
And then you think of the others.
All the other, because sometimes a lot of times people say what is the chicken or the egg? Because remember I was telling you about the 4 pathophysiology. So people are saying if your barrier function is improved, and you can actually reduce the immune dysregulation, because when your barrier function is impaired, you get all the allergens coming into your skin, and that's set up and a cascade of inflammatory reaction. So the barrier function is very important. And if you look at we have a clinical practice guidelines which we published in 2018, and I was involved with one of the developmental committee for the CPG of atopic eczema. And for all severity of atopic eczema, from mild, moderate to severe, it's always moisturizer or emollients we call. So that goes across the board.
Emollients with urea.
Not necessarily, because some people do get irritated with a bit of urea. So it barrier function, you have to see what type because there's a lot of moisturizer.
Right.
And we need to educate our patient to use the moisturizer that they like to use and the ones that doesn't irritate them.
Right. I'd like to move into another part of managing eczema, which is managing eczema in kids. For us adults, just learning how to deal with it, and the discipline that comes along with it is something that has to be learned. Because we always think that there's a super pill that we take and everything's going to get better, and it doesn't quite work that way. Now with children, a lot of parents are having problems with dealing with eczema or contact dermatitis with regards to children in Malaysia. What are the bigger problems, or what should we be thinking about if we have children who have eczema?
Yeah. Well, again, as I said, back to basic moisturizer, but how to use this moisturizer in kids. So the mom or the carer has to be, very much in tune of the needs of the child, especially in terms of their skincare. So sometimes it's difficult to apply. The children will be scratching, and you tell them not to scratch. Even for us adults, they tell us not to scratch. You will still scratch. What more children? In children, we sometimes use what we call the wet wrap therapy.
Wet wrap. Okay.
Yeah, so I'm not sure whether you've heard of that.
Right.
It's actually tubular cotton bandages, or sometimes they have a garment, a wet wrap garment, where the first layer is slightly wet, because that would increase the moisturizer effect for the skin, and the second layer is dry. So we do have that in our hospital Kuala Lumpur, and sometimes we bring the kid and the parent into the ward to teach the parent how to use this wet wrap therapy.
Right.
And that would not we normally use during an acute, when the eczema gets really bad, because that would actually prohibit the kid from scratching, because you have a barrier and the kid won't be scratching. So that is another way to manage children with atopic eczema. We sometimes we mummified them in a way.
Right. Okay. So some kids need to be mummified,
yes,
just so they don't scratch.
Scratched.
Right. But other than that, what other things should parents consider? When you just find out your kids, before they're 1-2 years old, they already have these problems, and it's going to be lifelong. So what do they need to start thinking of for the long haul?
Yeah, for the long haul, as I say, again, back to moisturizer, but sometimes a younger age group, kid less than 2 years old, 1/3 of children with atopic eczema do have a trigger factor of food allergy. So not all, but about 1/3. So the mom, would you subject the mom to a food allergy test, for the children? Normally we look at, first of all, whether the barrier function has been we've already done all the anti-inflammatory lotions for the kids, which is most of the time it's the topical steroids, and whether we've look at the barrier function mechanism, whether that has been sort of corrected, and then we look at whether is there something that triggers, and as I say, less than 2-year-old kid, it could be triggered by a food allergy. So not all children. And then we look at what do you think. We would normally ask the mom, what do you think that makes the eczema flare? Because then there are tests to then confirm what the mom suspect. So we don't really do a blanket food allergy test, because what are you going to test? Because if you do a blanket food allergy test, it would cost at least 2,000 ringgit for a blanket of so many tests.
Right.
So we will ask the mom, what do they suspect of the, first, after we've corrected all the things that can be corrected, and then we look at food allergy, especially in less than 2-year-old, because as you grow older, you actually develop a tolerance to certain food that you think you may be allergic to. I mean, my son had some food allergy to eggs when he was about less than 1 year old. If he eats egg, his whole mouth gets red and he breaks up into an eczema. And I kind of slowly introduced it, and he developed a tolerance. Now
he's grown out of it.
Yeah, he takes 2-3 eggs per day in the morning for his breakfast to build up his protein. So we do get we build up a tolerance, because our body is also very smart. So doesn't mean you have to eliminate that food which you think is cause food allergy for the rest of your life.
So now what I want to move into, we've got about 5 minutes left, and I think if we can move into very quickly, a lot of us are going out. I want to talk about treatments or from severe or treatment-resistant eczema, but I think we'll just do away with that and talk about going out to your pharmacy and getting a good moisturizer and a good body wash. I think that's where it all starts. Now, what would be your go-to standard with that? Because there's just so many brands, and I'm not brand selling here. You know, you're paying 180, 160 ringgit for a moisturizer and a body wash, and you get a lot of Australian brands coming up and saying that, you know, we've got the body wash and the moisturizer, but what should I be looking for? Well, if I can't spend 180 ringgit a month, what should I buy?
Well, what should you buy is a wash that has not got a lot of perfume, a lot of you know, a lot of preservatives. Okay, so there are eczema brand, you know, which are out there in the market. So most of this eczema brand has not got much perfume. So even a Baby Johnson, okay, I'm not really.
No, please just mention it. We just want to know things that are affordable.
Yeah, so even Baby Johnson's, actually, they have lots of perfume. Sometimes my eczema patients do get allergic to those baby products. You know, so that's why I'm saying, a lot of the times you want something that does not have perfume. So if you kind of go something without perfume, like even like simple, you know, products, they're without perfumes, and that already solves half the problem. And then you look at preservatives, and then you look at the added ingredients, and that's where the 180 ringgit comes to be, you know, because those added ingredients, filaggrin being added on, ceramide being added on.
Ceramide,
so, and that's why it gets very expensive.
So if you go look, you know, and I'm once again not selling creams here, creams like Ceradan, Dermalex, stuff like that come from overseas, people pay a lot of money for them. So should they be buying this?
Well, if the eczema is bad and they've already you know, done a lot of things, you know, and so this, sometimes when it's really bad, we're actually asked to buy these products because we don't want to irritate further the skin. So those, as I say, without perfumes, not much preservatives, so you may need those expensive products.
Okay, in 3 minutes, here's a very important question. Now, I don't know if I was conned, but a lot of people say, you buy this cream or you buy this soap and your eczema will disappear slowly.
Okay.
Yes, no, maybe.
No. So that you work on, because there's no cure for eczema.
You don't have to mention it on national TV, but thanks.
No, there's no cure for atopic eczema, but there is cure for contact dermatitis if you identify the allergen.
Okay. No cure for atopic dermatitis, but there's cure for contact dermatitis. Once again, atopic dermatitis, contact eczema, contact dermatitis and atopic eczema. What's the difference?
One is coming from you. It's an endogenous eczema, atopic eczema, and it's a lot of genetic, there are some genetic component, but contact dermatitis is coming from outside. So you're exposed to the allergen that makes you allergic to a product, for example. And it's quite common.
Coming from one of the biggest hospitals in the country with the most volume of people going there, what would be your advice to all of us in Malaysia with regards to dermatology or taking care of your skin?
Okay, so my advice to Malaysians would be, first of all, there's always hope in terms of your skin condition. There's a lot of studies happening for atopic eczema, so don't think there's no light at the end of the tunnel. And second of all, make sure you look at the product. Whatever skin care that you buy, even if you try to go into Shopee, look at the ingredients. Okay, if there's lots of perfumes, lots of preservatives, think twice, because this is going to hurt your skin. And then secondly, you know, taking supplements would not really cure your skin ailment, because sometimes we find that supplements may cause more harm than good. So these are, you know, and lastly for atopic eczema, moisturizer, moisturizer, moisturizer. Very important.
The three important words in dermatology is, we find out today after half an hour, moisturize, moisturize, moisturizer.
They don't moisturize enough.
We don't moisturize enough. On that note, we'd like to thank you very much, Dr. NOOR ZALMY AZIZAN, consultant dermatologist, Hospital Kuala Lumpur. She's also the immediate past president of PDM. She joined us today to talk about eczema and dermatology, to give us a bit more of an insight. And the one takeaway we know now is, make sure your creams or your soaps don't smell, and also make sure you moisturize, moisturize, moisturize. Did I get that right?
Yes.
Thank you very much. It was a pleasure and an honor speaking to you.
Thank you.
And thank you for staying with us right here on Ratnam TV.